So, Ani, Mathew and Dishnakas, Wapsheshin Dodem, Wasoxing and Donchaba, Anishnaabe Minwa Jagna Shindao. So, hi everyone. My name is Mathew Hupfield. I introduced myself in my traditional language, Anishnaabe Moin. I'm Martin Clan, and I'm a member of Wasoxing First Nation, and I have both Anishinaabe and non-Indigenous ancestry. Um, of course, I'm enrolled in the BA in Public Health program, and I'm specializing in Indigenous people's health. When I began this program, I was living in the traditional territory of the Okanagan Silks peoples with my family, knowing that I wanted to acquire skills and credentials to work in Indigenous health, public health, and community wellness. My family and I now live on the eastern shores of Georgian Bay in the traditional territories of the Anishinaabe peoples of Wasauksing First Nation and Shawanaga First Nation. So the move to Ontario meant that I had a really special opportunity to do my practicum placement with the social department in my home community of Wasauksing First Nation. Wasauksing First Nation is located on the eastern shore of Georgian Bay in Ontario, near the town of Parry Sound, and it's accessible via the Wasauksing Swing Bridge. That's an old railway bridge that connects the island to the mainland. Wasauksing has almost 1,400 band members with a non-reserve population of 421 community members. The Wasauksing Social Department provides social services for community members that range from community wellness programs that support youth and elders to child well-being supports for children and families involved in the child welfare system to direct supports such as social assistance. So the social department was perfectly situated to offer a dearth of experience working on community wellness programs, community outreach, program development, cultural events, and interprofessional collaboration in an Indigenous community and government setting. My responsibilities and learning goals at my practicum embrace the interdisciplinary opportunities for learning, and that meant I got to do a lot. So I had to focus in on three key areas. The first was assessing community readiness, needs, and assets in order to address increasingly prevalent food insecurity. This included connecting with elders, community members, existing programs and services, and other departments to develop a larger food security program for the community. Second is evaluating existing cultural safety resources used by social department programs. And we're trying to gauge whether they might instead be applied as cultural safety practice guidelines for the whole department. This exercise initially began as a comprehensive effort to inform practice, screen external practitioners, and promote cultural safety. But through our consultations with the team, it became evident that the scope should focus on developing staff capacity and cultural humility. And then lastly, I was supporting program planning efforts by participating in the social department's annual work planning, supporting staff with the development of program plans, logic models, evaluation frameworks, and budgets. The timing was really fortuitous, really, as the team was taking on this big exercise right while I was there doing my practicum. Three PHSP values emerged to inform my work during my practicum. So with the programs ranging from child welfare prevention to social assistance program delivery to Meals on Wheels, working with the social department at Wasauksing necessitates collaborative action across programs, teams, and sectors. And further, community-based approaches and partnerships offer a vital route for centering community voices and perspectives to ensure that cultural safety needs, community readiness, and community priorities are met. So during my time with the team, cultural programs, practices, and ceremonies have been really resurgent. So a lot of workshops and events and camps happening. So co-designing programs that respect Indigenous rights and knowledges is definitely part of the battle. But one thing I really saw while I was in my practicum was just how persistent colonial policies stymie the resourcing and funding of these programs. The reality is that the programs often happen in spite of funding parameters and eligibility, not because of them. So that was a sobering reminder of the importance of Indigenous self-determination and self-governance. And then addressing health inequities, of course, is a vital avenue for improving health in Indigenous communities. So while my practicum placement situated me with colleagues that are working on addressing social determinants, it became abundantly clear that many on-reserve community members are experiencing health inequities that are the result of unfair and unjust health inequalities due to socioeconomic status, indigeneity, geography, and access to care. So while Wissahickon First Nation is benefiting from a recent increase in on-reserve primary care accessibility, social and life determinants of health heavily impact and influence how social and health programs are accessed and received by community members. And one of the big themes that really emerged from meeting with elders and community members is just how they often talked about the way things used to be in the community. And this is recent memory. So people would talk about time when social cohesion was strong. Community members would hold community events, host potlucks, support each other through crisis, do come together to build a house. They'd be pooling resources. And it just became evident that a lot of the things we learned about residential schools, colonial government legislation, Indian day schools, and the ongoing removal of First Nations children by child protection agencies are but a few factors that have contributed to the erosion of supportive social networks and community wellness. So in many respects, it was, again, a stark reminder of how colonialism has been a key driver of Indigenous health outcomes in the past and today. So key insights: working with community cannot be paternalistic. That means both understanding how existing social norms and systems of oppression, such as racism and colonialism, adversely impact community wellness, as well as recognizing that community work has to center the voices of the communities we work with. So doing my placement with Wissahickon First Nation highlighted how the mental, spiritual, physical, and social harms caused by colonial legislation and residential schools require a holistic approach for promoting wellness. First Nations communities must be able to exercise self-governance and self-determination in order to develop and implement the solutions that will address the wellness needs of their community. Again, as it bears repeating, the reality remains that stringent government funding systems and paternalism stymie and limit efforts to redress the impacts of colonialism. I chose the TRC Call to Action 21 to draw attention to, and it states that we call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that the funding of healing centers in Nunavut and the Northwest Territories is a priority. Of course, healing generations of cultural disruption, intergenerational trauma, and ongoing systemic repression won't be achieved through piecemeal solutions. And Indigenous healing centers offer a promising institutional model that communities like Wissahickon First Nation are really advocating for to center Indigenous conceptualizations of healing that are self-determined and self-governed. During my practicum, I developed and maintained an event planning spreadsheet for the team to use for community events. It was something I was really proud of doing. This included our annual Family Day ice fishing derby, the opening of a family violence safe home in the community, and the employment fair. I was asked actually to be the master of ceremonies for the employment fair, which had a 5-hour program with a welcome, moderated panel, and community draws and raffles. It was a lot more than I signed up for. But it was a fun opportunity, and it also helped to show me how much this event helped to provide employment networking opportunities, as well as being a valuable opportunity for community members to gather and celebrate. So it's been a special practicum experience. It's doubled as a bit of a homecoming for me and my family. And I just want to say how grateful and thankful I am to my practicum supervisor, Kelly King, community members, family, Natalie, for your guidance and support, and more broadly, my peers in the program and the awesome group members for our group assignments and instructors who have provided support along the way. That's it. Miigwech.